Yang Berhormat Dato Noeli Ashilin binti Dato Muhammad Razi, Perak State Exco Housing, Local Government and Tourism, Yang Berusaha Tuan Khairul Amir bin Muhammad Zubair, Yang di Pertua Majlis Perbandaran Taiping, Yang Berusaha Mr. Colony Anak Gunting, Deputy Under Secretary, Policy of Women, Family and Community Department, Yang Berusaha Professor Madhya Dr. Siti Anom Ahmed, Director, Malaysian Research Institute on Aging or My Aging, Yang Mulia Professor Dato Dr. Tengku Aizan Hamid, Project Consultant, Age Friendly City, distinguished guests and participants, members of the media, ladies and gentlemen. Salamat pagi and a very good morning. On behalf of the United Nations Development Programme, I would like to warmly welcome each and every one of you to the launching of the Age Friendly Survey. Aging is a major global trend that affects all countries, albeit at different paces and levels. By 2050, the world's population of over the age of 60 will double. This demographic change has strong implications for sustainable development and the future we want. Over the last few decades, Malaysia has been experiencing improved health, longer life expectancy, low mortality, as well as declining fertility. The combination of all these results in a change in the demographic profile of the country's population. The age structure in the past 4 censuses in 1970, 1980, 1991, 2000, and 2010 shows that the proportion of younger age group, 15 years and below, is decreasing, while the proportion of elderly is on the rise. For example, the median age was 17.4 in 1970, 21.9 in 1991, 23.6 in 2000, and is currently at 29.2. Official statistics show that 7% of the population of Malaysia is now above 65 years and above, with an annual increasing trend. Malaysia defines elderly as 65 years and above. With this rate, Malaysia is expected to become an aging nation by the year 2030, where the elderly population comprises 15% of the total population. However, public health experts claim that Malaysia has still not got adequate health and elderly care facilities to support the growing aging population. What's more, aging is a multifaceted issue beyond health. Social support systems, socioeconomic well-being, productivity, and sustainable income and personal dignity and empowerment may reinforce one another in a vicious cycle. This is further exacerbated by COVID-19 impact, when the elderly were shown to be more vulnerable to the virus, as well as its economic devastations. Many, especially in the informal sector, are not protected by social protection schemes, while a majority have been dipping into their retirement funds to make ends meet. Hence, there is an urgent need to address the challenges of an aging nation through a holistic framework. In this vein, we are honored to partner with the Ministry of Women, Family and Community Development on an initiative to develop an age-friendly cities framework to prepare for an aging nation by 2030. The framework will support the National Policy for Older Persons, which came into effect in 2011, to support reintegration of the older persons in society and instill older persons with a high sense of self-worth and dignity. The project's progress has been delayed by the COVID-19 crisis, of course. Today's session aims to train enumerators to collect baseline information from the elderly in Taiping, our pilot city, to feed insights into the development of the country's first age-friendly city framework at the local level. I view this as an important process to listen actively, empathetically, and to record the needs and pain points from the elderly communities in Taiping. Subsequently, a spectrum of stakeholders, including the local government, business owners, and targeted vulnerable groups, will be engaged for feedback in developing a local action plan to transform the city of Taiping into an age-friendly city. It is an important journey which UNDP is proud to be on board. It is my wish that learning from this project will inform the national policy here in Malaysia, particularly on creating more sustainable solutions for the aged communities by integrating their needs into the design of urban plans. I also wish you a good session and look forward to receiving the findings. Before I end my remarks, I would like to record my appreciation to YB Dato Noili Ashlin binti Mohammad Radzi and Young Dipertua Tuan Khairul Amir bin Mohammad Zubair from the Municipal Council of Taiping for their leadership and commitment in working with My Aging, the consultant team, the Ministry of Women, Family and Community Development. This is an exemplary example of much needed collaboration from the local to the state and to the federal agency coming together in attaining sustainable development as articulated in the 2030 Agenda for Sustainable Development, including to fulfill the pledge that no one will be left behind.